Good afternoon, everyone. My name is Sarah Chaudhry. I'm the Director of Communications here at the college. Thank you for joining us for this year's keynote address presented by Uppala Chandrasekhara. Before I introduce Uppala, let's go over a few housekeeping items. This session, like the others, has live captions. So to turn on your captions, click the Show Captions button below the video player. You can choose to see the captions in either English or French. Today's keynote will have some Mentimeter polls that we encourage all participants to check out. If you want to participate, please go to the URL that you see on the screen with the access code. If you need tech support throughout the keynote address, please use the support chat at the bottom left-hand corner of your screen. Click on the icon and you'll be connected with our live support team. There will be an opportunity to ask questions at the end of the keynote. You can submit your questions through the chat feature on the right-hand side of this session's page on the virtual portal. It is now my pleasure to introduce our keynote speaker, Uppala Chandrasekhara. Uppala is a social worker with over 20 years of experience in the health sector, ranging from frontline work, assisting individuals and families with mental health and addictions issues, to supporting mental health and addictions programming province-wide, and implementing the national strategy to address mental health across Canada. Currently, Uppala serves as the Director of Public Health at Toronto Public Health, where she's responsible for public health strategy and clinical services. Prior to this role, she was the Director of Public Policy at the Canadian Mental Health Association, Ontario. Uppala is also an assistant professor at the Factor Inuitash Faculty of Social Work at the University of Toronto. Through her research, published writings, and work in the community, Uppala examines the impact of the lived experience of discrimination and racism on the health, mental health, and well-being of marginalized populations. During today's keynote address, Uppala will be focusing on the pivotal role social workers and social service workers play in dismantling systemic barriers and fostering inclusivity, and how the commitment to social justice fuels efforts to create a more equitable society where everyone can live with dignity and respect. Please join me in welcoming Uppala Chandrasekhara. Thank you so much for that wonderful introduction. Hello, everybody. Hello, those of you joining us from far away. I'm so thrilled to be here with all of you. And I especially want to thank Denitha Bro and the entire college staff team for welcoming me. And it's been such a pleasure working with all of you leading up to this. And today, really, I know my description sounded kind of serious. I wanted to do something fun and actually talk about how do we unlock our superpower. I know, you think this is funny, right? Let's go to the next slide. I actually think that social workers and social service workers, we're superheroes. I really believe that we're superheroes. And so I want you to hear me out on this. Let's be evidence-based about it, and let's do a definition and break the definition down so we know exactly what we're talking about here. So I really believe we're superheroes who don't wear capes. Let's go to the next slide. So I want you to think about what are the characteristics of a superhero. We're going to go to Mentimeter now. So what I want you to do is to write down the first thing that comes to your mind when you think about a superhero. What are the characteristics? Oh, here we go. Patient, brave, kind, integrity, resilient, strong, supportive, champion, fearless, love it, empowering, authentic, dependable, a helper, super strength, goes above and beyond, Selfless. Wow, keep them coming. This is awesome. Courageous. Passionate. Empathetic. Unstoppable. Honesty. Smart. That's a given. Invincible. Fair. A leader. An advocate. It keeps growing. Perseverant. I think I covered most of the big words that are coming up. This is awesome. Thank you. 380 responses. Thanks so much, everyone. So we'll go to the next slide. Thank you. So when I was trying to define what a superhero is, I went to a group of experts, my children. I have 3 of them. They're 3, 6, and 9 years old. And they helped me define what a superhero is. And right now they're in that phase where they're totally obsessed with superheroes. So Ninjago, Captain America, Iron Man. They especially love Miles Morales in the new Spider-Verse series. It's pretty great. It's kind of on constant repeat in my house. So they help me define what a superhero is. So first of all, a superhero possesses extraordinary skills that other people do not have. Does that sound like us? I think so. Second, every superhero has an origin story about how they obtained their extraordinary skills. Thirdly, a superhero always uses their skills to help others. Now, I can't think of anyone better than social service workers and social workers to fit that bill. Let's keep going. Next slide, please. A superhero has a mission to save the world. Now, I know this is true. I know that many of us have a personal mission to save the world and to make changes in the world for the better. A superhero conceals their identity. We are all very good at doing that. And a superhero understands the power they hold. So what I want to do is go through these points one by one and really think about how do we exemplify these superhero qualities, because I think we really do. So let's go to the next slide. So the first one. A superhero possesses extraordinary skills. I believe that our training, our skill set, it is an extraordinary power and something that other professions simply do not have. And when we think about, next slide, please, our training, there's such incredible values that go behind our training as social service workers and social workers. Respecting the dignity and worth of all people, it's part of our core values. Our ethics are driven directly by our training and by our college. We advocate for social justice, the overall benefit of society, the environment, and the global community. We value human relationships. We show respect for the intrinsic worth of the clients that we serve. We carry out our duties with integrity and objectivity. We work with our clients by maintaining privacy and confidentiality. We take an anti-racist and anti-oppressive stance in our work. This is so important. This is part of our core values. And we're committed to fostering diversity, equity, inclusion, and belonging in all aspects of our practice. We also have some incredible skills across the board. Some of our skills, I can't name them all, but active listening. This is an important skill. How many other professions lack that skill? The active listening. Motivational interviewing. We own that. That is what we do. And there's so many different therapeutic modalities. CBT, DBT, EMDR, mindfulness-based stress reduction. It's what we do. I can go on and on about our skills all day. I really believe that our training is our superpower. And the most incredible power we have is our ability to hold space for others, to share their innermost feelings, which is often a very scary thing for other people to do.
But we as social workers and social service workers, we know how to build trust, and we're able to hold space for people with empathy and with compassion. I can't think of a more incredible superpower than that. So let's go to the next fact. Superheroes, they have an origin story about how they got their skills. For some, it happened totally by accident. So Miles Morales gets bit by a radioactive spider, so he's the new Spider-Man. But for others, like in the X-Men, they're born with their powers. So let's go back to Mentimeter for this question. So tell us, what is your origin story? How did you end up in our professions? Was it totally by accident? Or did you always know that you were meant to do this work? The numbers are climbing. So far, most people are saying they were born to be in this profession. Well, the numbers for totally by accident are climbing. This is great. There are about 200, more than 200 people participating. The numbers keep rolling in. Okay, thank you. So it looks like majority of the people feel like they were born to be in this profession. And about half that totally by accident. This was awesome. Let's keep going. Let's go to the next slide. Next slide, please. So I want to tell you about my origin story. I actually started my career off as a correctional officer. I was really young, and at that time, I thought law and order is how you save the world. And so I was actually planning to become a lawyer. And at the time, my parents lived up in Iqaluit in Nunavut. And so I would visit them from my breaks from school, and I got myself a job as a correctional officer. And I worked in a secure custody youth justice facility. And at that time, it paid me a lot of money. I won't tell you how many decades ago this was, but it was $26, $25 an hour. It was a ton of money for me, and it's how I put myself through school. So on my days off, I would also work at the local RCMP holding station. And this is where I learned that the justice system is the catch-all for all of the cracks in our healthcare system. When someone was experiencing a mental health crisis, a call would go into the RCMP, and a police officer would be sent out to pick up that person. And that officer would bring that individual back to the holding cell, and my job as the guard was to watch them, make sure they weren't harming themselves. And if in the morning I thought they looked okay, I had no training. If I thought they looked okay, we would just release them back into the community. No connection to psychiatry, no connection to social work or social service work, no connection to any kind of healthcare service. And we like to think that things are so different in Ontario. It is not. What is the only true 24-hour crisis response? It's the police. And we're trying to shift that, right? There's lots of interesting co-response models now popping up all over the province. We have social workers co-responding with police now. We have nurses co-responding with police. They're called mobile crisis intervention teams. We also have a really innovative program in Toronto called the Toronto Community Crisis Service, where it's civilians, mental health trained professionals are actually responding instead of the police. But how many decades later, right? It has taken a really long time for society to create space so that people in our profession actually can be the first responders to mental health crisis situations. And a lot of that happened because of shifts in policy, people like us advocating for this kind of change to happen. because it's legislation that actually puts the police officer in the pathway of a mental health crisis situation. In every province, there's a Mental Health Act. In Ontario, we have the Mental Health Act. And in it, it regulates that it's a police officer that shall apprehend an individual. Why not social workers? Honestly, I ask this all the time. Why doesn't the legislation reflect us? We have the authority to apprehend children, but why not adults? That requires legislative change, and that kind of legislative change will never happen if we're not represented at those tables where those decisions are made. So I can talk to you on and on about my career, but those early experiences in the justice system, it really changed me. It shaped me. This is why I do so much criminal justice reform work even throughout my career. But after that experience, I immediately ran off and became a social worker. It's like the justice system is not for me. So throughout my career, I've worked all across the healthcare system in frontline capacity. I've worked in community health centers. I've worked in hospitals. And the majority of the time, I spent about 13 years with the Canadian Mental Health Association. I loved my time there. And about 2 years ago, I had the honor of joining Dr. Eileen Davila and being on her executive team at Toronto Public Health. I am the only social worker on the executive team at Toronto Public Health. Not only the only person, but the first ever social worker. So think about that. Toronto Public Health is 140 years old, and I am the first and only social worker to be on the executive team. So that's pretty incredible. And so that's a little bit about my origin story. I'm starting to bring more social workers into the fold. Public health is very nursing and physician heavy, but we're starting to change it up. So let's continue with our definition. So we talked about the origin story. Superhero always uses their skills to help others. This sounds like us, right? Let's go to the next slide. So again, what words come to your mind when you think about how social workers and social service workers help people at the individual level? What are the words that come to mind? Let's go back to Mentimeter for this one. How do we support individuals? We listen, we're supportive, we care, we're compassionate, active listening. We help people navigate, we encourage growth, kindness. We give attention, validation. Oh, that's a really important word. We validate experience, making connections. The word empower keeps coming up. It's such a great word. We hear them. We provide choice, options. There is integrity in our work. Vulnerability. We create safety. Love it. We're non-judgmental. We meet people where they're at. We are present. We encourage. We're resourceful. Yeah, that's a big one. Oftentimes we're stretching our resources. Humble. We ask. We're inclusive. This is great. Thank you for participating. I think all of these things are true. Wonderful. Let's go to the next slide. So I want to share some stories about some of the work that I've been able to lead at the individual level. And I think these are very relevant when we think about our professions as we move into the future. The first one I'll talk about is a picture in the middle. At the start of the drug toxicity crisis, which was back in 2016, 2017 in Ontario, I helped to lead the development of Ontario's first community-based opioid overdose response protocol. At that time, we didn't know what naloxone was. We didn't know what the impact of the overdose crisis was going to be, and we had no way to respond. And at that time, really, it was physicians leading this work. And we needed to pause and say, how do we, as community-based providers, support this? We didn't have the tools. So one of the key things I was able to lead with my colleagues at the Canadian Mental Health Association was actually to bring together an interprofessional group of people talking about how do we do this? How do we actually develop a response protocol? There were social workers at the table, there are nurses, physicians, and this is one of the key things I'm so proud of. We developed a protocol for how do you recognize the signs and symptoms of an overdose and how do you respond? And then after the response, how do you support the staff who've been part of that response? Because an OD response can be very traumatic no matter how many years of experience you have in the field. And that kind of thinking, the after, how do we care for the staff? That is a true value of our professions, thinking about how do we support those individuals who are doing the work. If we go to this picture here on the right now, I'm so honored to lead clinical services at Toronto Public Health. And a lot of the clinical services that we provide are directed specifically to low-income residents of Toronto. And this is a picture of myself and Dr. Davila at the launch of our dental caravan program. We're providing dental care at long-term care homes in the city. And there are almost 30 clinics that provide free public health dental care in this city. And we served over 20,000 clients last year and 60,000 appointments. So one-to-one clinical care is so important. And I actually say all the time, dental health is mental health. When we think about that, the kind of confidence and abilities and self-worth someone feels when they have a smile they're proud of, it's huge. It goes such a long way to their intrinsic worth and value. And a lot of professions, dentists, they don't really think about the mental health component of it. And there's so much fear also going to the dentist. So many people fear it. So there is an impact on our mental health, the experience of having oral health care. And these are the kinds of conversations I'm able to lead because of the skill sets that I have learned throughout our profession. One of the most significant impacts I think I've had in my career is helping to create this program called Talk Today. Again, this is from my time at CMHA. I have to tell this story because it is incredible. So about 2015, there was a young man. He was from Rexdale. He was, a young Black kid from Rexdale who was part of an Ontario Hockey League. And he got caught smoking dope or something like that. And he got a text from someone on the team saying, your career is over. Now think about that. Your family has invested so much time and energy into your career. A lot of these players, they don't live with their families. They live with billet families far away. And imagine getting a text like that. Sadly, this player, his name was Terry Trafford. He went missing for a few days, and then he had died by suicide. And it was all over the news, and it was so, so tragic. And such a lovely human, but he didn't have the supports that he needed. And at that time, the Canadian Mental Health Association reached out to the Ontario Hockey League and was able to establish a partnership so that that kind of tragic instance never happens again. And this program, I have to be honest and say I've never seen an idea go from idea generation to planning to implementation to full-out expansion as fast as this happened. Because the Canadian Mental Health Association, it's nationwide. Hockey is nationwide. Think about it. In every town, small town, big city, hockey is immense in this country. We actually figured out a way to tie suicide prevention training and support into a sport that young people love. And think about that demographic, young boys. How do you engage them with anything? Like, my kids aren't that big yet, but The 6-year-old? Yeah, there's no way. He's still not listening to me. So how do you engage that level of youth? It's so hard, and you have to do it through something they love. So what we were able to do is create a program that increases awareness, teaches them how to recognize signs and symptoms of illness, not just the players, but also all of the adults surrounding the team. So the billet parents, the parents of the players, and also the coaches, providing them with the tools to do that. So every single CMHA in Ontario has a mental health coach that's tied to a hockey league, which is incredible. And over the last 10 seasons, CMHA has been able to train 8,500 elite athletes, providing one-to-one support. This is the kind of incredible work that we can do when we really start to think at a population level beyond the one-to-one care. Let's keep going. So we talked about this. Let's all admit right here, we're all out to change the world. I know. I can pretty much guarantee that every single person in both of our professions, they're on a personal mission to save the world. And it doesn't get more superhero than that. So next slide, please. So let's go back to Mentimeter and ask this question. What words come to your mind when you think about how social workers and social service workers help communities? So the previous question was about how we help individuals, but how do we help communities? Advocate. Absolutely. Care. Outreach, volunteering, dedication, education, listening, awareness, being involved, building relationships, navigating systems, working collectively, engaging in programming, building networks, cultural sensitivity, asking for input. This is great. Organizing, yes. Collaboration, key. Empowerment, that word keeps coming up. Changing policies, being present. This is great. Mobilizing, that's a great word. Look at this, 377 responses. Thanks so much. Building relationships, being visible, role modeling, fighting stigma, voting, creating new programs, identifying gaps. This is so great. Thanks so much. Let's go back to the slides. Next slide, please. In my experience, having worked with social workers and social service workers for so long, I find that many of us shy away. We shy away from systems and policy and strategy work. There are those of us who think that we don't have a role to play in policy development. I'm here to tell you that each of us has a very important role to play. Providing one-to-one care, we're working with individuals and we're impacting one person at a time. But when we work at a policy level, we have the ability to impact hundreds of thousands of lives at once. That's the key piece. And those of you who truly want to save the world, working in a strategic policy at the population level, that's how we change the world. Hundreds of thousands of people at a time. When I look back on my career, some of the most impactful population level work I have done has been leading anti-racism strategies. Because for most people, racism happens in moments. They happen in moments, right? It's individual interactions or community interactions, but it's also the moment a policy or a piece of legislation or a rule is enacted, and therefore we feel discriminated. So working at the level of anti-racism strategy is really, really important for me. Working at the population level also requires that you fundamentally appreciate that only what is measured can be effectively understood and improved. And this is where data is so important, the analysis of data, the collection of data. We have to first collect and analyze data before we can take steps towards change and progress. And that is true of any population level health strategy, but it's especially true when we're trying to advance anti-racism. Over the years, I've supported many different organizations with sociodemographic data collection and race-based data collection. I've done this in hospital settings, in community health center, at a national health organization, and also with the police. And that was very hard. It is very hard in terms of bringing these concepts to a system, to a place that fundamentally doesn't understand it and requires individuals like us to find the words, to find that medium and find that balance to actually explain why we're doing this and why it's important. So I was so happy when the college approached me and asked me to support their equity and inclusion data initiative. And I was able to support that work from its onset several years ago. So many of you probably already know this. Starting last fall, every registrant at the college during their annual registration renewal process can complete a sociodemographic survey. It's totally voluntary. You can decide which questions you want to answer, and it only takes a few minutes to do. I did it myself as well. But what's really important to think about is the analysis of this data. Analyzing this data is going to help our college understand how we reflect the population of Ontario. And if in some areas we're overrepresented, then we can begin to engage with those communities that we represent. But if in some areas we're underrepresented, then we need to develop strategies to engage those underrepresented communities in our professions. Because you saw the words come forward. Empathy, understanding, reflecting the community, that is so important and vital to the work that we do. This is how we're going to advance our professions into the future. Working at a strategic policy level, we can begin to make huge shifts in our ecosystem around us. So let's keep going. A superhero conceals their identity. I think this totally describes all of us. We do this actively in therapeutic interactions because of transference. We conceal parts of ourselves so that we don't endanger our clients. It is part of our training. That means that we're experts at concealing how we are truly feeling inside. Am I wrong? Mm-hmm. We're experts at concealing ourselves. And many of us hide our struggles. So I wanted to take a moment and talk about that. Next slide, please. Here's the reality, and these stats come from the Mental Health Commission of Canada. 1 in 5 people have a mental health issue, and this is in a given year. It's 1 in 3 across a lifetime. Over 20% of the working population have a mental health condition. And 500,000 people didn't go to work this week because of a mental health issue. That includes us. That includes 1 in 5 social workers and social service workers. We all need support too. Next slide, please. When I teach, I'm always talking to my social work students that I can't teach them what self-care means. We can't teach others what self-care means. It is an individual journey. Each of us have to define what self-care means for ourselves. And it has to be something we can do in 10 minutes because that's the reality. We typically have 10 minutes between clients or we have 10 minutes between meetings. We need to do something within 10 minutes that allows us to breathe, allows us to feel grounded and supported so that we can take a breath and move on to the next thing. For me, it's music. In 10 minutes, I can put in my headset and just listen to something. And I actually do this. If I'm upset for a long period about something, whether it's an issue at work or in my personal relationships or something that's happened with a client or a student, I actually try to find a song that reflects either the lyrics of my situation or the sound of the song actually reflects my mood or my feeling. And I listen to that song over and over and over and over again. And usually by the time I'm sick of the song, I'm kind of done with that feeling. So when we don't have hours to process our own feelings, it's good to have something to do in 10 minutes. And so next slide, please. I want to tell you my story because I think it's really important. And it's taken me many years to be able to share the story publicly because of the stigma surrounding mental health issues. We think that it's going to be a huge barrier to advancing in our professions or to the next level of our career. But I want to share mine with you. This happened almost 20 years ago. So here's a picture. This is a beach in Sri Lanka. It's beautiful. We came from Sri Lanka when I was very little, and I think many of you know it's a 30-plus year civil war. We had not been back. And then my sister, I have an older sister, she met this guy who was Sri Lankan, meet a guy in Canada who's Sri Lankan, and my parents thought he was perfect. He's an engineer, he was good looking, and he's Buddhist like us. So the whole family was so excited, and we were going to return to the motherland to have a beautiful wedding. And I don't know how many of you've been to South Asian weddings, but they're massive, and there's a lot of colors and saris, and it's like a week-long thing. So this is what my family was planning. And at the time, I was in my last year of undergraduate education in my last semester. And I was working 2 jobs. I had a full course load. And I had no idea what I was going to do next. And I was already at capacity with my mental health, I would say. And I lived above a restaurant with 3 of my roommates. It's Toronto. Rent is really steep. So we lived in this tiny apartment, and you know, my parents lived in Iqaluit, so I wasn't close to my family physically at that time. But we all decided we're going to Sri Lanka to have this wedding, and we were super excited. And the wedding was beautiful. And just a couple of days later, the tsunami struck. If you think back to 2004, hundreds of thousands of people died instantly. And a lot of hopes, dreams just washed away. And many countries, including Sri Lanka, but also other surrounding nations, are still recovering 20 years later from that devastation and loss. But for me, thankfully, my immediate family survived. And we got to come back to Canada, to paradise, and leave that all behind. And I struggled with that for many, many years. You know it as survivor's guilt. But also, it was a really hard time for me. I had nightmares all the time. I couldn't sleep. I couldn't eat. I couldn't get out of bed. I just wanted to lie there with the covers closed in the darkness. I didn't want to do anything. I couldn't do anything. And when I think to those times, there were 2 people who saved me. 2 people. One was my academic counselor. So I was a student at U of T at the time. There's a big Sri Lankan population at U of T. And they immediately went into action. They set up a fund to support any students who were impacted. And the moment I asked for help, they were able to provide it. And so my academic counselor really took care of my social determinants of health. He made sure I didn't have to, work that semester. They got a bursary in place so that I could pay my bills. He worked with my professors to push my deadlines forward so I could still graduate on time. And he got me an appointment to see a mental health professional, and I saw them within 24 hours. I had a really positive experience. Many of the people we work with don't have that kind of positive experience, and the system doesn't respond quickly in those moments. But I had a really positive experience. And the second person who saved me was a friend. And this friend did not try to tell me everything was going to be okay. They did not deny my experience. They came and laid next to me in the darkness. And I know without those two people, I wouldn't be alive today. And that friend, fast forward 20 years, he's now my husband. We have 3 kids. It's a beautiful story. And, he's a big reason I'm here today. So I share this story because this isn't a typical story. It's a happy one. And the ones that we face with our clients are not always like this. How many times do we see a client where we're the last resort because they have tried so many other avenues that have doors slammed in their face and they were told, no, this is not going to work. This isn't helping. And oftentimes we're the last resort. And I share this story with you because I want to normalize this conversation around mental health. Even within our professions, we are the experts in this. It's our superpower to support other people's mental health, but we still struggle to talk about it amongst us. And for anyone who's struggling, I really want you to know that you're not alone. Many of us are struggling, and we're just so good at hiding it because that's also one of our superpowers. So I want to ask you, this is an anonymous Mentimeter. Tell us, if you feel comfortable, how many of us are struggling too? The responses are coming in, and it's very obvious. And many of us are struggling often or sometimes. A key thing that we always talk about with other people that I think we also need to reflect on is we need support. I know we have clinical supervision. Yes, another therapist is excellent for that. But we also need our own therapist to support us. I've had a social worker for the last 20 years, actually, since I started my training. And I talk to my students about it all the time, that it's actually an investment. It's an investment in ourselves, but also in our profession and in our career. We need the ability to have that level of support because eventually our loved ones are going to get tired of us talking about our issues. So we need that level of support. And I encourage anyone who hasn't yet found that support person, please reach out. There are how many members of our college who are trained and supportive and have the superpower to support you. There's no reason to do this alone. There's no reason to think that you don't need it. We all need it. We're very good at, accessing other health professionals, right? We go to the dentist. We go to a registered massage therapist. So normalize this and add this to the suite of services for your wellness. It's so, so important. Thanks, everyone, for participating. Next slide, please. So now, next slide, please. Now I'll get to the final point of our definition. Superhero understands the power they hold. Next slide, please. We know that with our great power comes great responsibility. Yes, that's a Spider-Man quote. We have the ability to influence population health, but we have to put ourselves out there to impact the health of the population. That means being really brave and sitting at really scary decision-making tables. Evidence-informed policy is the key to population health and advancing population health. And embedding our values of social justice, that is key to advancing population health. But if we're not at the table, we're just relying on other professions who don't have our superpower to speak for us. So if we're not there, if we're not at those tables, there is no one speaking for us. And so we have to be brave and sit at those tables to make big changes and big shifts happen. I'm going to end with this. Next slide, please. Michelle Obama, I love her. And I love this quote from her. And she says, when you've worked hard and done well and walk through that doorway of opportunity, you do not slam it shut behind you. You reach back and you give other folks the same chances that helped you succeed. This speaks to our obligation to pass on our superpower. We all need to mentor others. Those of us who've been in the field a very long time, we need to pay this forward. We need to support up-and-coming social service workers and social workers. And if any of you haven't had the opportunity to become a practicum supervisor yet, please run out and do it right now. Register. All of the education programs need more practicum supervisors. It's such an incredible experience for you, for the student, and it's a wonderful way to give back to our professions. I think it is our duty as superheroes to pass on our superpower to the next generation. And so I'm going to end, next slide, with this. And ask you to reflect. How are you going to unlock your superpower? We all have it within us. How are you going to unlock yours? So I'm happy to take questions. I know they must have been coming in.
Thank you so much, Upala. And I can see from the chat feature that's been going through today's keynote just how engaged and appreciative everybody was with today's keynote and you sharing your story and those vulnerabilities. So thank you for that. So as we said, we do have time for some questions. As a reminder, you can enter in those questions on the right-hand side in that chat feature. We will try to get to a few before we take a break for the next sessions. We do have someone asking if you could leave us with one sentence or phrase or word, what would it be?
That's a stressful question. I think it would be compassion. We are so good at compassion. Compassion for other people, compassion for community, compassion for society. We also have to have compassion for ourselves because the work that we do is so incredibly challenging and not everyone can do it. This is why we're the superheroes. And I think compassion is the word I would leave you with. Thank you for the question.
Thank you. We are getting a ton of comments just thanking you for your keynote today. One comment in particular saying, "What an inspiring and informative presentation. Thank you for normalizing struggle and being courageous in the face of fear. Thank you."
Thank you.
We do have another comment saying, "Yes," in all caps. "Social workers and social service workers have unique perspectives and voices. Thank you." We do have a question from someone asking how they might get involved in policy initiatives.
Oh, okay. There's lots of ways to do that. So every level of government typically puts out a consultation process for every initiative that they're leading. So they do that sometimes quietly, thinking you're not going to know when they're consulting, but every level of government does that. So it's actually really easy to do that. You can submit a letter, you can ask to speak someone, and typically they'll identify how you can get involved. But another really easy way to do it is to follow your city council proceedings. Every item that comes to city council allows for deputations or the boards of health across the province. You can go depute on anything. Typically, you get 3 to 5 minutes. And if you think that a particular strategy in your community doesn't have a social work lens, the board of health is there to listen. So also, I'll tell you that if you go with a group of people, it's always more effective, right? We're good at that. So if you have the same message and you all share the same message and the Board of Health hears it 100 times, exact same message, they're more likely to take action rather than if only one person went. So I really encourage you to do that. The local municipal government, that is your access to and gateway to policy and advocacy.
Thank you. We also received a comment from someone noting that they can also access through program advisory committees as well.
Absolutely.
So we have a question. Even people who appear to be strong have vulnerabilities. What is a good way to share that with others?
I think the more we talk about it, the more we're going to encourage other people to talk about it. So I shared my story with you, hoping that you'll feel comfortable sharing your stories with other people too. And there's so much fear around, how are people going to receive my struggles? And I think the best place to start is among us. Who better understands us than each other? So I think engaging in those conversations, the more all of us start engaging in those conversations, the more we're going to encourage other people to share.
Thank you. There is an individual noting that they agree that systems level work is vital and important to make the most impact in people's lives. Could you offer up some simple and practical ways that could be done, considering many social workers and social service workers work full-time and have other responsibilities?
Great question. I think it's really important to volunteer, actually. And volunteering, I know it takes time, but volunteering on a board of directors is the greatest way to learn about how policy and systems change can happen. And so in every community, there are community health centers, there are other nonprofit agencies that are always looking for people with our skill set. And if you live in their catchment area, now you're even more attractive candidate for that kind of board. And engagement, I know all the college members of the board are here today. So engaging at that level actually allows you to look at an organization from a very much a systems perspective, because the level of conversation that happens at a board of directors is very different, right? It's about funding. It's about how does our organization fit with legislation. So the conversations you're having are at a very, very much a strategy and policy level. And so I would say that is the fastest way. But the ideal job is half policy, half clinical. When I was going through social work school, I did my MSW at Laurier in Waterloo, and I got to do one practicum in clinical and then one in strategy and policy. And I would say to myself, the dream job is to do 2.5 days of clinical and 2.5 days of strategy and policy. And it took me until this particular job to make that happen. So half my days are filled with clinical service delivery and half are filled with strategy. And I just absolutely love it. And sometimes it was a little confusing and overloaded. But I think that even if we work strictly in clinical practice, we have an opportunity to engage in strategy level work. I know time is hard, but a lot of these boards, they have virtual meetings now, and they're typically once a month. So there are ways to fit those in. But also on the flip side, those who work in strategy, let's keep our clinical skills alive. There's lots of opportunity, especially now with virtual care, for us to have a private clinical practice that's not part of our day-to-day work. I know lots of colleagues who do that. Actually, a colleague of mine still has a clinical practice even though they're working in strategy and policy. So there's ways to fit it in amongst the busyness of everyday life. But I really encourage, don't give up one thing to do the other thing. Our skill set is so valuable that we actually have to try to influence both spheres.
Thank you for that. Some additional comments. Thanking you for your transparency. Noting that someone noted that they've always volunteered but never heard anyone talk about it as an essential skill development. So thank you for that. A comment, those that have experienced hardships or trauma develop a certain kind of empathy and understanding while rising above the challenge of overcoming this, and survivors are able to share that skill of empathy and empowerment. And I know you talked about this throughout your keynote address. Someone asking, of all those personality traits and out of all of those superpowers that are essential for social workers and social service workers to be effective in their role to help vulnerable populations, which one would you say is the most essential?
Oh, of all the ones I shared today, I shared a lot today. The most essential. I think probably the one I ended with, which is understanding our own power. It's actually part of our training. We do so much around use of self, understanding power dynamics between our clients and ourselves, between our communities and ourselves, but understanding our power and knowing how to engage with communities, knowing how to engage with individuals and families. I think that is just essential. It's the kind of training that other professions I have not observed them having. The power dynamics that we learn about that are intrinsic to our training, I think, is very key, and that is a cornerstone of our superpower.
Thank you. A lot of comments coming through, again, just praising today's great session. Others also sharing opportunities to volunteer at boards, which is really great. It's a very engaging chat. We'll maybe just wait another few moments to see if there's other questions. Additional ones just noting examples for where they can volunteer. So I think that's wonderful. So we may just leave it at that. And I do want to...
I have one more slide.
Oh, yes. Please go ahead.
Yeah. So I just wanted to say, really, thank you so much for having me here today, and those of you watching from afar. It's really an honor to be here. And please feel free to get in touch. I've provided my contact information here. So really, big thanks to the college for having me. Thank you.
Thank you again, Upala, for providing such an insightful and inspiring keynote address. We really appreciate it. And just as a token of our appreciation, we have made, the college has made a donation to the Indigenous Women's Fund of Canada today for your keynote address. So thank you again.